Hello everyone! I hope you had an enjoyable and relaxing weekend. Our second week of class starts with issues related to students with autism spectrum disorder. It was really nice to see all these relevant sources addressing different issues in regard to this population. I noticed that there were about 4 themes that were going on in today's module, and luckily they addressed the objectives that we had for this module. While Lindsay and Rachel were focused on environmental and genetic factors that play a role in autism spectrum disorder, Brittany and Nate addressed the issues that concern technology and autism. The majority of you addressed issues related to what autism is and what are some of the characteristics that distinguish this population from others. Sophie, Delane, Christine, Taylor, Jennifer provided relevant resources addressing various issues. Ashley's resource addressed history of autism, which is great because it addressed the first objective for this module. As teachers, it is really important to know how to work with these students, and the resources selected by Audrey, Adria, and Megan provide great information about instructional strategies that effectively can impact the students' educational performance. You might find quite surprising that autism spectrum disorder is among the least understood and most mysterious disabilities in special education. As Ashley's resource talk about the history of autism, we have to understand that it wasn't until 1943 when Leo Kanner, a psychiatrist at Johns Hopkins Hospital in Baltimore, identified the symptoms that characterize autism. Kanner described 11 children with an inability to relate themselves in the ordinary way to people and situations. When describing this condition, Kanner used the term autistic, which means to escape from reality. Although Leo Kanner identified individuals with autism in 1943, it wasn't until 1977 when the American Psychiatric Association decided to include the term autism in the Diagnostic and Statistical Manual. Before that, APA didn't recognize autism as a separate disorder. Since 1980, autism has been characterized in the DSM as a pervasive developmental disorder to highlight the fact that autism is a developmental disorder of childhood and not a psychotic disorder like schizophrenia. However, in May 2013, DSM-5 used a new terminology, autism spectrum disorder, as a neurodevelopmental disorder and not anymore a pervasive developmental disorder. The new edition consolidates autistic disorder, autism, Asperger disorder or Asperger syndrome, and pervasive developmental disorder. So what is autism spectrum disorder? The APA characterizes autism spectrum disorder as persistent deficits in social communication and social interaction across multiple contexts, including deficits in social reciprocity, nonverbal communicative behaviors used for social interaction, and skills for developing, maintaining, and understanding relationships. In addition to the social communication deficits, the diagnosis of autism spectrum disorder requires the presence of restricted, repetitive patterns of behavior, interests, or activities. So, a child diagnosed with autism spectrum disorder can be assigned one of 3 levels of severity, recognizing that severity may fluctuate over time and vary by context. You probably have heard the expression that you can find 2 individuals with autism that are the same. That means that severity may fluctuate from one end of the spectrum to another end of the spectrum. So classification is based on the amount of support that is required by these individuals in their everyday functioning. The DSM-5 offers the following 3 levels. Level 1, requiring support, level 2, requiring substantial support, and level 3, requiring very substantial support. Taylor's resource posed the question, what should teachers consider when working with students with autism spectrum disorder? Definitely, this is a question that is worth answering. So what should we really do? Several resources talked about ways to support students with autism in our classrooms. More specific strategies, then also another resource on multitasking and tips for teaching students with autism. In addition to the videos that were posted by Nate and Brittany in regard to assistive technology. All of these resources provide relevant ideas and suggestions on how to help these students. I think that each of the resources provide relevant information on how to support students with autism spectrum disorder in your classroom. However, I would like you to put a main emphasis on applied behavior analysis when working with this population. Applied behavior analysis is a scientific approach to examining behavior. Interventions that are based on ABA follow the operant model. This means that learning is the result of consequences that follow a behavior, and these consequences determine the likelihood of a behavior occurring in future again. The operant model involves three main parts: an antecedent, a behavior, and a consequence. An antecedent is the event or experience that happens before behavior occurs. The behavior is the response or lack of response from an individual, and the consequence is what happens right after the behavior occurs. Based on the consequence, the behavior might increase, decrease, or maintain in the future. This is called the three-part contingency, or you probably will hear it as the ABCs of ABA, and it is the basis for ABA interventions. Although no one intervention has been identified as the most effective for all children with autism, strategies that are based on principles of ABA have the most empirical support for this population. Something that is important to understand is that the ABA is not synonymous with one method or one technique. ABA-based interventions range from highly structured programs that are conducted in a one-on-one treatment setting to more naturalistic inclusion programs that include typically developing children as models. Some ABA programs are more distinguishable than others, like discrete trial training or pivotal response training, whereas other programs use the principles of ABA, such as the ABC that we talked earlier. A critical piece of information for future teachers is that students with autism are visual learners. So if I personally am interested in improving social skills of young children with autism and also decreasing challenging behaviors and improving appropriate behaviors, video-based instruction is an evidence-based practice that has been successfully used to improve social skills of children with autism, including their social initiation skills. Video-based instruction is a compilation of strategies that are used to teach behaviors by observing video footage of the target behaviors as models for the learner. Video-based instruction is comprised of several types, including video modeling, video self-modeling, video feedback, point of view modeling, video prompting, and so forth. I personally have been using video self-modeling and video feedback in my research, and I'm very satisfied with the outcomes so far. When working with children with exceptionalities, including children with autism, it is important that you think of ways to accommodate your instruction, their responses, the learning environment, assessment, schedule, timing, and so forth. In conclusion, I would say that students with autism spectrum disorder typically require a diversity of educational interventions and teaching strategies. However, it is well established that most effective instructional strategies are those that are structured, they are predictable, and geared to the individual's level of functioning. Overall, the most successful programs for students with autism spectrum disorder are those that begin early and are intensive, continuous, and multidisciplinary. Thank you.